Hello, my name is Madeline Bell. I'm an EMT instructor in New Orleans. Today I'm going to be giving you all a lesson on how to make sure a patient's airway is patent and how to ensure that it stays patent as well. Now, one of the most important things an EMT does is ensures that the patient's ABCs are controlled. What is that? Well, A stands for airway, B is breathing, and C is circulation. ABCs is a way for students to remember the three most important things to assess and maintain while treating a patient. Today, we're working on A. A is for airway, as I've said before. The fastest way for me to tell if a patient has a patent airway is for me to simply talk to them. If they're talking to me, they're proving to me that their airway is open and they're able to maintain it. However, not all of your patients are going to be able to talk to you. When that happens, you have tools at your disposal to make sure that it stays open. If this patient cannot prove to you that they can maintain it by talking or anything like that, you are not going to trust that they will. So you're going to utilize a tool. Now, you have two tools for this. You have an OPA and you have an NPA. OPA stands for an oral pharyngeal airway. Like the name suggests, oral, it's going to go in the mouth. Now, before you put this in the patient's mouth, you need to make sure that they're a candidate for it, which means you're going to look at the mouth. You see any broken teeth? Is the jaw misaligned? Is there blood, right? You want to make sure. Is there vomit? Huge thing. The patient has vomit, you want to suction it out, right? Once you have made sure the patient's unresponsive or unconscious, there's no blood or vomit or anything in the mouth or in the throat, and there's no broken jaw or teeth, that you can put the OPA in. You want to measure it first. The only thing worse than no airway is an improperly placed airway because we don't want to hurt them, right? So you take it and you measure it. Every patient is different. That's why you need to make sure you're using the proper tools. These come in many sizes. Don't want to put one too small because they can simply swallow and choke on it, right? Take it, you go to the corner of the mouth, go to the earlobe. Looks like this one would be a good size for me. Take it, put it in sideways, and you want to turn it like this. You put it in sideways to kind of help that get that tongue down, and you turn it sideways because you want to follow the curve of the neck, as you can see. Now, what this does is it makes sure that that airway stays open and the patient's able to breathe, or you can breathe for them for ventilating. A huge issue with OPAs, however, is that patients have what's called a gag reflex. What that means is that they start gagging, they start puking, and they get all that vomit up in their throat. You have just now made an unpatent airway by putting this in. That's okay. We can fix it. You take it out when you notice gagging, and you suction it out. Make sure you always suction coming out versus going in, okay? Once you have seen that the patient's airway is okay, you ventilate them for a bit, you try your other tool, which is called an NPA. Just like an OPA is oral, NPA stands for nasal pharyngeal airway. Make sense? Easy to remember, right? Just like the OPA, we need to measure this. If they're a little too big, that's okay, we can cut it, but you cannot use one that's too small. So, first thing you do is make sure this patient is a candidate for the NPA as well. You look at the nose. Is it bleeding? Okay, is it broken? If you put it in someone's nose that's broken, there's a chance it could go into the brain. And we don't want to deal with that, right? We want to fix problems, not cause them. So we take it, and just like the OPA, we measure it. Take it from the nose, corner of the nose, to the earlobe as well, okay? And then we want to put it in. Before we put it in, however, the nose has such thin membranes, it does not like stuff going in, you know it's supposed to come out, you sneeze, that if you put something in dry like this and you shove it in, you're probably going to make the nose bleed a bit, which is bad because remember, blood loves to clot. Clotting is going to cause an occlusion and you have another problem. So what you do is you lube it up. There should be lube on the truck. Comes in a little package. Now if there's not any, for whatever reason, you can use the patient's spit. Okay? Pop it in their mouth. Cannot use a patient's blood because just like we said before, blood loves to clot. So we take it, we measure, and we make sure we put it in properly. The best way to put this in is in the patient's right nose. Some patients have what's called a deviated septum, which means it probably isn't going to go on the right side. What can you do? You can put it in their left side instead. So you take it and you go bevel up. This is the bevel towards the septum, right? So what we do is we put it bevel up towards the septum, and then we want to start gently. We don't want to shove it in, but twisting could help. You know, we want to make sure that it gets in. I'm not going to put it in myself. Sorry, guys. When it's in properly, it's going to follow the curvature of the neck as well. See how it is, how it curves? This makes sure that the patient has an airway that's open, and you're able to ventilate for them after A is done, because ventilated comes in B. Remember, ABCs? But this makes sure that the patient's airway is good to go for the rest of your assessment and while you're transporting and treating this patient to the hospital. Like we said before, is if it doesn't go on the right side, you can always use the left side. Always make sure that if you have to do that, however, is that you're cleaning this off and you're re-lubing it, all right? Same issue. If you get some blood on it from going in the side, we don't want to just shove that in the other side, because we want the patient's prognosis or well-being to end up good. For this class, we're going to split up in teams, and we're going to practice on the mannequins while I watch, and then you're going to practice with each other, not in each other's noses, on the mannequins, to make sure that you understand the proper ways to do it. So always, I'm here to help if you have any questions.